The measles outbreak in West Texas is growing. Within the last hour, the Texas Department of State Health Services shared updated case numbers. The total of cases now stands at 223. That is up from 198 since last Friday. This is the largest measles outbreak in decades, and it could go on for a while, maybe months. Keep in mind that total is specifically related to the outbreak in West Texas. It does not include the case Austin Public Health reported, which was in an unvaccinated baby after traveling abroad with their family. Now, that local case also isn't expected to cause any additional exposures. But we asked Dr. Edgar Navarro Garza, a pediatrician from Harbor Health, to join us here on KVUE News Midday to answer some top questions. Welcome back.
Thank you for having me.
What are some of the top questions patients have asked you?
Definitely, like every day that my patients come to the clinic, the biggest concern comes to like, should I be concerned about measles, especially with my baby, right? What is measles, of course, right? How do you get sick of measles? And what are ways that I can prevent from my child getting the measles?
Yeah, and so how do you answer those questions?
Well, first and foremost, measles is a viral infection, so it can just get spread through the air, like someone coughs, sneezes. The problem with measles is highly contagious, like someone that acts as like a gymnasium, and you're like across the gymnasium, you can still get exposed to the measles.
Wow,
right?
in the gym?
Yes,
okay.
That's the level of contagiousness, right? And the problem also is because the virus can last on the air for up to 2 hours.
And surfaces, right?
Yes, exactly. And then again, with measles, you'll get like a high fever that will be followed by runny nose, stuffy nose, maybe like pink eye symptoms, cough. And then a few days later, you will develop a rash that starts on the head and then goes through the whole body.
How long do those symptoms last, doctor?
So like for instance, once you get exposed to the measles, it can be like up to 2 weeks before you start having symptoms. And then it will be like 3 to 4 days of like these cold-like symptoms with high fever, and then you will develop a rash that can last for like 7 days.
Okay.
Now you can be contagious of the measles like 5 days before having the rash and 4 days after you have the rash. So that what makes it like even more complicated.
Oh my goodness, yes, highly contagious. What are you telling young families with babies who can't get vaccinated yet?
Absolutely, that's a great question. First and foremost, stay calm, don't stress, don't worry. Right now, we should not be like in an extreme alert, but we want to be careful about it, right? So the cases that we've been seeing here in Texas, especially West Texas, which has been an outbreak, they're highly concerning, highly alarming. Luckily, we don't have cases here in Austin other than the one that we have for international travel. First and foremost is like remain calm, come to your doctor's appointments so we can keep discussing about your concerns, right? If we start seeing outbreaks here in Austin area, then we can consider what will be the next step of management.
Okay, so for kids that are too young to get vaccinated, what's your suggestion?
Exactly, so the earliest that a baby can get vaccinated in an outbreak situation will be like 6 months. So any baby younger than that, it will be like recommendations as many other infectious diseases. Hand washing, wear a mask if you're sick, avoid crowded public places, especially if it's closed space, right? So I always like encourage my parents that like, if you're gonna go out, try to be in an outdoor space.
And so vaccine hesitancy, real quickly, we're running out of time, is a major concern here. A lot of people not getting it. What can you tell people who are on the fence about getting vaccinated?
Absolutely, and that's a great question. Vaccines are safe. There has been a lot of research, especially like in the last couple of years with the people not wanting to get vaccinated because the fear of like autism was at one point, which was debunked, the fear of like side effects from the vaccines. There has been so much research done regarding the vaccines and their safety. So they're totally safe. And the benefit that you get from the vaccine outweighs any risk of not getting the vaccine.
Yeah, it was eradicated, what, 30 years ago?
Exactly.
And here it comes. All right, thank you so much for
joining us. Thank you for having me.
Appreciate your outlook. And